WarsawJS. Hi everybody, it's a pleasure to be invited to this talk. And Daria Hemmerling, working as a software engineer at a soft-serve company and a Yosh AI, as well as I'm the assistant professor at IGH, University of Science and Technology in Krakow. So today I came to you from Krakow, traveling by train in the morning. And in my expertise, I specialize in the voice and speech processing. And I wanted to share with you why I feel very motivated to study this and to actually explore it for about 15 years already. The speech actually is the easiest mean of the communication. So wherever you go, most of the people speak in different languages, but based on the speech, you can diagnose the patient and discriminate the emotions, for example. So you can recognize if someone is stressed or someone is relaxed, if someone is even tired. But also what you can recognize if someone has flu or if someone has blocked nose. But also what is very interesting is that also we can recognize different diseases like arteriosclerosis. Do you know what is arteriosclerosis in English? This is the heart disease, a very common one, which is caused by the small yellow cells going around your veins. So the blood velocity goes slower and slower. In the end, it blocks your heart, and in the end, you might die. So what recently was very interesting is that we can also diagnose it with the voice. But to do that, firstly, in the research, we need to correlate the phonetic acoustic results and the clinical description of the diagnosis and its progression. So what we do firstly in the software recognition is that we do the binary classification to detect the disease. And furthermore, we can use some regression tasks to perform the disease monitoring. But for whom? Actually for everyone, starting from ourselves. As we use the smartphones, we talk every day. We share lots of information about our state, about our feelings, about what we do and what we cannot do actually at the same time. So this information might be very useful for the doctors, so on the other side of the border, as well as for the patients. So if you already suffer from some disease, you would like to know if you're getting better, if you cannot do it by yourself. So what I've done in my life is I created a software which can do the global screening. And the performance is that for men, it can recognize perfectly if someone starts having flu or having some laryngeal diseases or other diseases. The software actually includes around 140 different diseases, which is really cool because those are very global diseases. But for women, some of the patients were classified wrongly. But anyway, the result is 99.9%. So in my...
Nice.
Thank you. So it's been tested already on 1,400 people, and hopefully will be also available somewhere for the global population. But what really interested me during my research was the Parkinson disease, which is the neurodegenerative disease, which is mostly familiarized with the shaking. So if we had the software which could monitor the disease progression, which is very, very complicated, and let the patients know if the medicine worked or you should come back to the doctor, would be really, really desirable. But also what interests me in my research is the connection between the augmented reality, you know, those glasses that you put on your head and you can see the real environment, and also, in addition, the digital world. So, for example, I can plot a digital person in front of me and still see the room. So what I want to do is to connect the results from all the sensors that are put into the Googles and correlate them with the knowledge that I already have about the clinical description about different diseases. So based on the augmented reality, which is going to be actually used more and more often by us, like virtual reality, I hope in the future, we could also monitor more multimodal data about ourselves, actually. So actually, just one statement. I don't know if you're calculating the time, but I wanted to let you know that beside the smartphone tech, already?
Yeah, you can have 1 more minute. Go.
Okay.
Go.
So the addition just to the smartphone technology, using the augmented reality enables us to monitor how we behave, so how we move, how we speak as well, what we see and how we move our eyes, what we put attention to. So we have lots of information. Thank you.
Wow. Not bad, not bad. Hello. Can you hear me? Can you hear me? Hello. Yeah. Don't go anywhere yet. Does anyone have any questions? I'm going to come and bring the microphone to you if you have any questions for our speaker. First you and then you. Yes.
That's impressive, I can say. And I have a question about how the room and the microphone affects the result of the screening, because I can imagine that, for example, an echo in the room can affect how we really see the problem by the model. And how can that be solved?
Yeah, what I've done for the last year at the Yosh company, we recorded people with 8 different microphones and also in different environments, starting from the soundproof room and ending in the gallery. And we compared which actually the software, which doesn't work at which step. So I have already experience in using different devices with different microphones in different environments. So for example, I might say that the iPhone technology really wins everything. And it's very similar to Sennheiser microphones quality, which is really impressive. But this is done because the iPhone technology has lots of microphones inside, at least 8. So, there's a matrix of microphones that we can remove the noise quite easily. But still, it is very difficult to recognize the person in the gallery. I cannot say about the disease detection actually in the gallery, as the signal is very, very noisy.
Thank you.
Hello.
Hi.
It's really very impressive. I'd like to ask if you need some previous sample, because you were indicating that in some cases we can see the progression of the disease, for example. But let's say that, I don't know, you pick a random person from the street and just run the test on him.
Yeah.
Will it find the disease?
Should. It should. Thank you for a great question. So first step in creating the algorithms is to get the data. This is the most important, to have the most varied data as possible. And then it's the testing part. So we have also some tricks in machine learning and artificial intelligence, how to test the algorithms if they work on limited data. But we also have the algorithms to modulate a little bit data, so to manipulate their quality and some parameters. But in the end, we end up with the testing in real environment. Did I respond it? No. So whenever if we go to the street where there are the cars, maybe you ask it about the environment.
No. Maybe I'll rephrase the question.
Yeah.
So does the software work much better when, for example, you have a sample of my speech from 5 years ago and you compare it with my speech today? Or would it work as well for detecting disease if I just give you the sample of my voice today? There's of course a chance of a startup when you have like when you collect the cells, the original embryonal cells, maybe you should also collect the voice at the early stage of people's life, so you can always compare it.
Yeah. I mean, I work with the voice. So if we had historic data, we can compare it, and this is what I do in the Parkinson's disease. That's why we can monitor and predict the treatment, actually. So, for example, the Parkinson's disease has some floating. It's called changing in on and off state. So sometimes the medicine, if it's too big dose, the symptoms of the disease appear too much. So you have to change the dose in this case. But changing the dose procedure actually is seen at home already, not at the doctor's office. So that's why we want to predict if the medicine works after 30 minutes, for example. And after 30 minutes, you cannot see the symptoms of the disease. honestly. So having the voice and knowing the prediction, we can predict.
Next question.
All right. First of all, thank you for working on problems like that. This is amazing and impressive. Thank you very much. And my question is maybe a silly one. How soon is it going to be better than humans at predicting the disease? What do you think?
I have no idea. I think the human knowledge is the priority for us, and we want to be the same right now as the human can be. But what we do with the physicians is that we support them. We don't want to exclude them from the diagnostic part. So we can only help them, but I don't eager to change them instead of the virtual machine or augmented machine.
Thank you very much. Give her a big hand, everyone.